So next we're going to go to Catherine Ferguson, who is the Associate Director of the Aspen Institute Community Strategies Group and Director of the Strategy Group Rural and Regional Initiatives. Before joining the Aspen Institute, Catherine served in many leadership roles in the Obama administration. Lastly, as Chief of Staff for the White House Domestic Policy Council and Chief of Staff for Rural Development with USDA. Previously served in senior staff roles with multiple U.S. senators, issues ranging from community economic development, economic mobility, agriculture, food, public health, and nutrition, and is now leading a newly funded center on behalf of the Robert Wood Johnson Foundation, which I'm sure she'll touch upon today. So, Catherine, take it away.
All right. A pleasure to be here with you today. As Alan mentioned, I'm with the Aspen Institute Community Strategies Group, and I'm going to ask all of you to come with me on a bit of a ride where we broaden the lens a little bit. We've heard people talk for the last few minutes, but also yesterday, about the broad and increasingly expansive range of people who are essential to health. And I want to do a little bit of work here to connect rural development, health, and opportunity, and focus in a little bit on the role of a specific type of entity that we call rural development hubs, and also talk some about policy, and particularly federal policy, though I encourage you to help think about local and state policy as well. So with that, I will dive in. And my objectives here, as I just mentioned, want to make this connection between community economic development and health, explore particular rural development hubs, and then we'll spend time on policy. So this, of course, is probably a chart you've seen before, but the point here is this is a chart from the University of Wisconsin's Population Health Institute, and really is the underlying framework for the county health rankings and roadmaps. I'm not here to talk to the underlying data under this model, but really want to just point out how this indicates what portion, really 50%, of health and health outcomes is really related to social and economic factors and the physical environment. And to me, this says we have to pay lots of attention to things beyond what's going on in the clinical setting and health behaviors. And certainly that's why we're all here today, because that is the basis of population health. What I see as somebody who comes at this as a generalist and with far more background in economic development and mobility policy than I do in health policy is that the social determinants of health have been just an absolute blessing in enabling creating a vocabulary and a framework and a structure that enables how people who think and care and work in health to think more broadly about all of the people who are on the ground who are essential to health. And we've heard many of those, as I mentioned, whether that was community health workers or this integrated behavioral health model. The community health needs assessment is a tool for looking at this. At the same time, what I often hear and what I often see from colleagues who are working in health is a lot of emphasis on these on folks across who are working in community doing, let's say it's a food pantry, it's somebody who's doing transportation work. What I want to call your attention to right now is actually so two different things. So all of these things are really important, and I think what we're seeing in part, this was always there, but COVID has really exacerbated our ability to see the way that disparities of place exist. So some places, if you look at the previous slide again, have great schools and great employers and lots of transportation services and mental health services, recreation opportunities. Some places just don't. Or they have subpar services, right? There are great disparities that have always existed, and COVID-19 is certainly making them more evident. There is a huge intersection between race and class and place. And as you can see from this map, which is actually something that the University of Michigan's Poverty Solutions Lab put together, that's really an index of deep disadvantage, looking at 5 different health kind of status factors, 5 different factors to judge, like what's it like to live in a particular place. You can really see that place matters, that there are great disparities, and that there are places For example, the South, the Black Belt is very much a place where poverty is endemic and the opportunity is limited. You also can see that place showing up again, and place matters. You look again on the Colonias and the Southwest border, much of Indian country. There are places where we need to take a much broader lens and think through how do we look at the structures and the systems that are making it hard to realize opportunity. So I want to call your attention now to a set of what I would consider development actors that are often less visible, and organizations and actors that I much more rarely hear folks who are working on social determinants of health and in the healthcare field talk about. But in my experience as someone working in community and economic development, these are some of the actors that are most aligned or can be most aligned with the approach of population health and are really critical to making systemic change in a region and a place. So some of these, which I'll call rural and regional intermediary organizations, you can see the list. We have financial institutions that are created specifically to serve underserved regions, like community development financial institutions and credit unions. There are lots of kinds of community foundations and health foundations and family legacy foundations that can all be essential partners in addressing root causes and making systemic change. Certainly you see other organizations, whether it's community action or community college, and sometimes these really interesting regional nonprofit organizations, not necessarily just direct service providers, but organizations that are really convening across a region that are taking a long view and are essential to change in that work. So you see, I've listed a whole bunch of organizations that I just don't see talked about much or it's hard to see them where they show up in the social determinants of health framework, but they're there and they're absolutely a critical partners to making progress. So a subset of these organizations of the list I just mentioned, we would consider at the Community Strategies Group to be rural development hubs. And here's the definition of rural development hubs that we've come up with, and that is a place-rooted organization that's working hand in glove with people and organizations within and across a region to build inclusive wealth, increase local capacity, and create opportunities for better livelihoods, health, and well-being. So that's a lot of things in one breath, right? But what we're trying to do here is make some distinctions and give some idea of the types of organizations that are playing a critical role in building communities across the region and really advancing health and opportunity. So we did some research to create this report we call Rural Development Hubs, Essential Innovation Infrastructure. And doing that, we interviewed 4 leaders across the country, people who are leading these hub-type organizations. And they were representative of all kinds of just different geographies, types of organizations working in very different places. And we asked them questions about their work and really aggregated information, both in what they said and then used a lot of what Aspen Community Strategies Group knows from 35 years of work in partnership with rural communities around the country. So here, I want to go back and mention again that rural development hubs, as we're talking about, the reason we've coined this terminology and are using it is because there are all kinds of organizations that are playing this function in community. It doesn't really matter what they're called. What's important is what they're doing. And so I'm calling these to attention because they may well be important partners to folks who are working in population health, but may not be visible or recognizable. Because if you don't know that you're supposed to go, it's easy to say, I need to go and pull in the person who leads the public health organization. It's a lot harder to say, is there a rural development hub in my region? If so, what kind of organization is it? And how might they be partners to us in the work that they already have done? That's more of a process. And so I want to make that more available and accessible to you today. So just to give you some examples here, these are all just the names and logos of a handful of rural development hubs. And maybe you know some of these organizations. I'm hoping you'll see one and you'll go, oh, in my region, I had never thought about that Hope Credit Union that works in Mississippi and across the Delta, that they might be someone who would understand the same framework and understand what we're trying to do in population health. Community Foundation that's located in Eastern California. Who knew? So take a look and hopefully you see an organization that resonates with you. So I think although these organizations I'm saying are radically different, in part, they have some things in common. And one is that they're really committed to doing economic development differently. And when I say economic development differently, what I'm talking about is an approach to community and economic development that is asset-based. It's not necessarily rooted in the old, much more traditional notion of tax credits and recruiting businesses and resource extraction. Instead, these organizations have a shared understanding that really what we need to do, the way to create vibrant, thriving communities, is to look at multiple forms of capital, not just financial capital, but really invest in individuals, intellectual capital, social, natural, built, political. They can see a much broader frame. They're really interested in rooting ownership in a region. They're trying to figure out not just how to generate growth and not just how to generate jobs, but rather how you create wealth and own it and root it locally so that the people who live in the region are the people who profit and benefit and grow and have better outcomes, whether that's family economic security or health status. Finally, these are organizations that are really thinking about improving livelihoods for those on the margins. They think and talk about equity in one way or another. They are inclusive. And again, they're thinking about livelihoods and how to improve the community in a holistic way. So it's not enough to recruit a business to a town. It has those jobs in it. They're looking for building from within, and they're looking for jobs and wages that are sustainable. So that's something that holds these together. And I just explained this a bit here, but what I've outlined here is a little bit of a difference between the traditional economic development toolbox and expanded hub kind of development toolbox. And what I would say for me, this is a difference, to create a parallel, is a difference between folks who think about healthcare and folks who think about social determinants of health and wellness and keeping and population health more broadly. It is this much broader, all-encompassing understanding of what's the task at hand. So I make all of this point because I really think that rural development hubs can be essential partners in progress on social determinants. And again, it's because they have this lens. They have very different language than maybe most of the folks who are working in health and healthcare, but they certainly have a mindset that is more similar to the folks who are working on social determinants and population health. And then you'll find among most others. So there's a quote here. It'll be in the files and I won't read it to you because you're all good readers, but I want to spend just a couple minutes here then thinking about, if these organizations are so important, what are the barriers and why are there not more of them? And why don't we just know that? Why aren't we all working with rural development hubs? And what can be done? So the report that we put together includes a lot of youth tools that might be useful to you in identifying how do you spot a hub and what are these organizations anyway? And I'd encourage you to take a look at it. I'll make sure the link is available to you. But at the end, we have a set of recommendations for how we can strengthen hubs and how we can create policy that's actually much stronger and would actually enable much more common partnership and progress among folks working on population health and folks who are working on rural development hubs. So there are a set of recommendations here. I want to spend just the last couple minutes, though really just focused a bit more on what's really in the way and where are we now in the context of COVID. So I think it's important to know that rural economy is really hardest hit by the recession in 2008, and so we have every reason to think they'll be quite slow to recover. And certainly, as it goes without saying, that COVID has really exacerbated disparities that are existing, whether that's racial, health, economic. And so it's kind of more critical than ever that we spend time figuring out how do we address the health issues and economic issues concurrently. And to go back to my initial point about the connection between health and rural development, if anybody ever questioned that health and the economy were separate or thought maybe they weren't related, COVID has proven that the two are integral and we must address both at the same time. So I think one of the challenges on the rural community economic development front that really gets in the way is that rural policy is just old. Most of it dates back to the 1860s when the Department of Agriculture was created. the 1930s, the 1960s, warm poverty. And the rural economy and the nation have just changed radically since then. So we're often working in pretty old architecture. And so part of why I'm mentioning this is because I think right now I would like to build momentum. And I think that population health and health folks really can be allies in helping to build momentum for modernizing federal rural policy in a way that helps to achieve both economic goals and health goals. And to do that, I think we're going to need a set of principles that we can agree on. These are a set that a colleague and I have at the Brookings Institute have come up with that are really rooted in what practitioners experience and have said is important to them from the local level. What needs to be true as economic development is done. And my guess is that some of these will resonate. And we've also been working on some papers with some suggestions and ideas for what it would look like. What kind of new tools do we need to put in the development toolbox to ensure that community economic development and population health are really working hand in glove with one another towards shared outcomes and shared ideals. And I think there's more in common than there is not. I will just finally note that I think there are a few things that are really concrete that we can do now to make sure that community economic development and population health are working together. And I've listed these out. We can maybe talk about them a little bit more as we go through conversation, since I'm aware of time. But we'll just call your attention more than anything to taking a much more asset-based approach rather than a deficit approach to looking at communities and being partners to them. And then really thinking about what are these basic tools that we all use, something like the community health needs assessment. Well, communities also have to do a comprehensive economic development strategy to access many federal tools. Are those similar? Are they different? Could they be aligned? I think there are a lot of conversations we need to have like that to bring these fields that are ultimately connected together in practice as much as they are in concept. So with that, I'll turn it back to you, Alan. Thank you.
Hey, thank you so much, Catherine. I think that was a really great primer on the kind of reciprocal relationships between the viability of rural communities, the viability of rural healthcare, and the asset base of community health, and how the three are so dependent upon each other, but often not just are siloed. I think view themselves as almost having different missions and visions, and when in fact, same people, same small places need to be all moving in the same direction and in a supportive way. So thank you so much for that.